local organization in Maryland who was nice enough to send me a template, which I then updated. So thank you to the Mid-Shore Pancreatic Cancer Foundation. So I think it's important to tell a little bit about what happened to me, because it may relate to, hope not, but it may relate to any of your situations. So as pointed out, last time I spoke to you was about the Jewish communities in Ethiopia, and early in 2019 I decided I would go back to visit them. And I also was retained to lead religious services on a cruise ship in Australia several weeks later. So I had to decide, well, when I'm in Ethiopia, should I fly back to LA and then go on to Australia? And I said, no, I'll just keep going around the world, which is what I did. So we're talking about a year before the pandemic, and I proceeded to fly around the world, and I then met my wife in Melbourne, Australia. We'd been apart for about a month, and she immediately saw that I was slowing down. And I didn't really notice it, but she did urge me to go to a doctor, and like any good man, I deferred, procrastinated, said, no, I don't know how to go to a doctor. But when I get on the ship, you know, if I still feel badly, I'll go to the infirmary. So when I got on the ship, I was still just not feeling myself. I didn't have anything specific I could mention other than I just felt run down. I thought it was probably the traveling. I went to the infirmary on the ship. They ran all the tests they could, and they said, well, we don't see anything, but we're not a hospital. So when you get home, you know, have further tests if you're still not feeling all right. So naturally, I got home and I didn't do anything until my back started hurting when I laid down in bed. And that was odd because I'd never had any back trouble. In fact, I'd never even spent a night in a hospital in my whole life. I've been healthy other than packing a few more pounds than I should have. But I had to sleep in a recliner, so I finally went to a doctor who, just out of luck, a friend of mine, Dr. David Chapman, happens to be a gastroenterologist, if I said that right, which is a doctor that specializes in abdominal diseases, and he did some more extensive tests and gave me shocking news that I had stage 4 pancreatic cancer. Now, I knew nothing about this disease other than I immediately did what I was told not to do. I consulted Dr. Google, and Dr. Google said that only 5% of people diagnosed live 5 years, and the doctors actually told me that it's 50-50 whether I would live a year. So let's go on to the next slide, please. So a few things about pancreatic cancer. As I say, I didn't really know anything at all about it, and I've since learned, unfortunately, it's the 3rd leading cause of cancer-related deaths in the U.S., and it's predicted to go up to number 2. Only lung cancer and colorectal cancer kill more Americans. And most pancreatic cancer patients die within the first 5 to 7 months. So it's been over 2 years for me, so I'm very lucky, beating the odds so far. The 5-year survival rate for someone with advanced is just 3%. And that's by comparison to an overall pancreatic cancer rate of 10%. 5-year survival rate for breast cancer is 91%, and for prostate cancer it's nearly 100%. Let's go on to the next slide, please. So what the heck is the pancreas anyway? It's a pear-shaped gland located deep in your abdomen. It makes enzymes, and most importantly, it makes insulin. Now, the problem with it being very deep in your abdomen is that it delays any feelings and symptoms. As I said, I didn't really feel anything wrong, other than I just didn't feel myself, and then I had this strange pains in my back, neither of which one would associate with cancer. Maybe I had an upset stomach, maybe I pulled a muscle, maybe anything. And in fact, chances are if you go to a doctor with symptoms like that, they'll run through a whole bunch of things before they would even consider checking you for cancer. So that's how I was lucky to start with somebody who specialized in that field. Okay, next slide, please. So here are some images. There won't be a test about this, but there's on the right, this is the head, the body, and the tail of the pancreas. The tail is the part on the far right that's sticking out. That's where my cancer apparently started. And where you have your tumors affects symptoms. I'll talk about that in a moment. But it's most pancreatic cancer tumors start in the head, which is connected to other organs. Okay, next slide. So, as indicated here, the greatest problems with pancreatic cancer are not only that it's so aggressive, but that there's no way to test for it. Many other cancers, I'm sure you know, have early detection tests. We have mammograms for breast cancer, and we have pap smears for cervical cancer. We have colonoscopies for polyps, and we have lung cancer screening and PSA tests for prostate cancer. But no tests have been developed or identified yet that could say, oh, you're not feeling well, let's do this test and then find out what you have. So this is one of the critical areas of need for research, and there is a lot of research, not enough, going on, but this is part of the problem. And the two main things I'm here to really tell you about today are telling you something about the symptoms, which I'll describe in a moment, and then just urging you to get tested for things that you might not, or consult a physician, and hopefully somebody who is familiar with abdominal diseases, for things that you may not think are related, because if you wait until it seems like something is really wrong and abnormal, then you don't want to be in my situation. Okay. Next slide, please. Before we get to the symptoms, there are some risk factors that are associated with a higher incidence of pancreatic cancer. Now, the average lifetime risk for pancreatic cancer is about 1 in 64. About 10% of cases are related to family history. Now, it turned out when I started consulting specialists, they asked for detailed family history, and I found out that I had an uncle who had died of pancreatic cancer. I knew he died, of course, but I didn't know that was the reason. If you have a first-degree relative, mother, father, sister, brother, or child who has had the disease, then you have a 2 or 3 times greater chance of it. If you have BRCA1 or BRCA2 gene mutations, which are usually associated with breast or ovarian cancer, that raises your risk. And if you have long-term type 2 diabetes for 5 years or longer, you have a 50% increased chance for pancreatic cancer. Also, pancreatitis, which is a long-term inflammation of the pancreas, is linked to increased risk, especially in smokers. And obesity is about 20 times more likely to develop pancreatic cancer. Now, interestingly, 5 years ago, I decided to become a vegan and have eaten a plant-based diet ever since then. Any amount of processed meat and more than around 18 ounces of fresh meat per week are strongly linked with a risk of higher pancreatic cancer. Now, I don't know whether my vegan diet has delayed, and obviously didn't eliminate the risk, but it may have delayed the onset, or it may have helped me to cope this long with it. I'm biased, but I would tend to think that it has. It has helped, especially eating broccoli and other cruciferous vegetables are associated with a lower risk of pancreatic cancer. About 20% of cases are thought to be caused by cigarette smoking. Risk of developing pancreatic cancer is 2 to 3 times higher than among smokers. Race, black people have a slightly higher risk than white people. It's lowest among Asian Americans and Pacific Islanders, and men are slightly more likely to get it than women. And then finally, age Almost all patients are over 45, and the average age is 70. 80% are between 60 and 80. Okay, next slide. Okay, so I already said there's no test, but there are some things that seem to be symptoms. I've already mentioned, well, let's start with PanCan, or as we call it, PanCan is called a silent disease. Who knows how long my tumors were growing and spread to other organs before I felt anything. And because the symptoms, which we're going to talk about in a moment, are vague and varied, they can be diagnosed, and usually are misdiagnosed as other abdominal or gastrointestinal issues. And because it's so aggressive, the misdiagnosis leads to critical lost time that one could be in chemo or otherwise. I honestly think that had I gone to a GP, I'd be dead by now. No offense to the GPs who may be here, but it's just, not as I say, not something that is immediately thought of if you come in with a stomach ache or a backache or just general feeling unwell. Okay, so the reason for the pain in the mid-back or upper abdomen is because the tumor is pushing against nerves or organs near the pancreas. And a tumor can also block your digestive tract. Unintended weight loss. That never happened with me, intended or otherwise, but it is a common symptom. And people often have little or no appetite, and they don't know why. They could also have indigestion and nausea as the tumor presses on the far end of the stomach or the first portion of the small intestine. One of the other things that can occur is jaundice, and that's because the tumor in the pancreas blocks the bile from flowing from your gallbladder into your small intestine. And you may also get itchy skin, abnormally dark urine, or light or clay-colored stools. I know this is lunchtime, sorry, but critical information. Many pancreatic cancer patients experience diarrhea, constipation, or both, and I won't go into details about changes in bowel movements, but I mentioned sudden onset of type 2 diabetes in people at age 50 or older. Especially if the person is not overweight, this might be a symptom, or change in your blood sugar if you're diabetic and previously it's been well controlled, but suddenly it seems not to be. Some other things which are not quite as common, swelling due to a blood clot, swelling in your arm or leg, a burning feeling in your stomach bloating, nausea, vomiting, chills, sweating, fever. Okay, next slide. Okay, so what happens if you're diagnosed? Is there any treatment? Well, as I indicated here, the preferred treatment would be removal of the tumor, but that's only realistic in about 20% of the cases. Radiation is sometimes offered before or after surgery and can be combined with chemotherapy. I never had surgery or radiation because it was too late in my case. I did, however, have 20 consecutive months of chemotherapy. Yeah, people would say, "Oh, I had 4 sessions of chemotherapy. How many are you going to have?" Until it stops working. And I had one regimen for a year, and then another one for 8 months, and they both stopped working then. The 2 FDA-approved regimens are FOLFIRINOX, which is a combination of drugs, and something called Genzar or gemcitabine, often used in combination. And I hope you don't know anybody who's had chemo, but you probably do or know of them, so you know there are a whole variety of common side effects, poor appetite, nausea, vomiting, rash, itches, lack of energy, hair loss. If you notice that first photo way back, I didn't have any hair. It's all going back. But I pretty much had all the symptoms, but all the side effects rather, but fortunately they were all pretty mild. I was lucky in Whether that, as I say, is attributable or in part to my diet, I don't know. But I feel fortunate that at the beginning, my wife went out and bought all these cleaning supplies and gloves, and she only had to use them once. So I feel lucky. Anyway, the next thing is called target therapy. Now, one of the most important things that's being done, and much research is in this area, is targeting your gene structure, especially mutations. So I was really lucky early on in my treatment. My oncologist, Dr. Park, found out that there was pills and research that were, well, let's back up. I had my tumors genetically tested, and the test showed that I had this very rare mutation. One out of 100 pancreatic cancer patients had something called V599, which was somewhat related to something called V600, for which there were pills for melanoma. This had not been tried on pancreatic cancer, and we didn't know whether 599 was close enough to 600 anyway, but managed to get what's called a clinical trial of one. Meaning the FDA said to my doctor, okay, if you want to use it, use it. And so he did. And that was great. Rather than going to the hospital every 2 weeks and then having chemo and getting home and still having chemo and spending several days in bed and all that every 2 weeks, suddenly I only had to, I mean, the bad news was I was doing it because I could no longer, and chemo wasn't doing anything, so I now had to do something else. But the good news is it was wonderful while it lasted. Unfortunately, I just found out yesterday it's not lasting anymore, so I'm in search of a clinical trial. But my point is that researching your tumors as well as your own DNA are critical. And that's, you may be familiar with immunotherapy, and that's using your own body's systems for defense. So if you, God forbid, or anybody you know gets diagnosed, you want to urge them or yourself to get your tumors tested as soon as possible, because there may be a drug in development that will really help you, as it did for me. Okay.
Thank you.
Most of the time, though, after chemotherapy, you're looking at clinical trials, and that means that doctors or researchers all over the world are trying to figure out whether new drugs might work. If so, are they safe? What dosage should you have? And how do they work with different groups of patients and so on? And there are thousands and thousands of clinical trials. And there's a government website, clinicaltrials.gov, that you can look up, and they will help you with the information. I think I've got about a minute left. Next slide, please. So there is hope. When I first embarked on this journey, a friend of mine, a physician, said, Art, be optimistic. There's lots of things in development. And I thought, well, thank you, you're being nice. I know it's important to keep a positive attitude, but I wasn't very optimistic. But in fact, he was right. And there were these pills that have been very helpful for the last 6 months, 7 months. What organizations like to say is that pancreatic cancer is not an automatic death sentence. It depends on how far advanced it is, where your tumor is. It actually is a pretty complicated disease, and maybe various places or things and certain enzymes that can be replaced and so on. So it's important, again, not to be Dr. Google and just look at the statistics and say that's the end. If you're early, then it's probably not, and if you're in the late stages, then you still may have years to go. But the main thing, again, I want to emphasize to you, go to the next slide, please, is to be proactive. Don't ignore any normal symptoms that you might think is just a nagging stomach ache or a backache or something else. suggest it to your doctor who may not consider that possibility. It's not that you want to be a hypochondriac, it's just that you can't afford to be wrong. You know, it's just, it's too aggressive, it moves too fast, and the consequences are too great. Help other people who have pancreatic cancer, their caregivers, and so on. Encourage additional research, especially for early detection. Next slide. There is an organization called Pancreatic Cancer Action Network. They provide a lot of assistance in a variety of areas, from clinical trial referrals to patient support and funding advocacy, and so on. And then finally, the last slide. This is the first time I'm speaking about this, but I would like to talk to other groups. So if you know of anybody else, whether a religious group or the Rotary or civic organizations, please let me know. And you might even consider doing your own. You're welcome to use my presentation or modify it however you want. So thank you, and if we have time for questions or afterwards, however you want to handle it.
Just real quick, Art, so much appreciate what you're doing now, how you're approaching this, sharing with us. Can you tell us what kind of support from family and friends, just quickly, that has been most meaningful and helpful to you and your family? What can we do for others who are going through this?
Well, I think you all heard the question. To repeat it, or but what kind of support have I found most helpful? Well, you know, it's a funny thing. People hear cancer and they kind of disappear. So that's been even members of my own family, cousins and others, suddenly don't call anymore. And when they eventually do, they say, "Oh, I didn't want to bother you." Maybe. But on the other hand, there are people who I wasn't particularly close to, an acquaintance and one cousin on the East Coast, who suddenly have become very involved in my life, and that's greatly appreciated. So I would say, don't assume that a person that you're going to bother them. You know, they'll tell you now's not a good time. Don't assume that no time is a good time. And remember the caregiver too. So my wife fortunately has a very strong and wide network of people, including several who've lost their husbands recently to cancer. So that's been good.
Thank you.
Yep.
Two questions. What hospital did you get your treatments from? And how was it determined you had stage 4? Was it an MRI or a biopsy or something?
Okay, second question first. Well, all of the above, actually. So first, if I remember the sequence, it was Dr. Chapman, the gastroenterologist, first ordered a CA19-9, which is a cancer blood marker, not specific to pancreatic cancer, but he ordered that and it came back, you know, higher than normal. And then he sent me for an MRI, which showed the tumors, and then he diagnosed based on that, but said, "But we want a CT scan just to confirm." I think, and so I had that, and it confirmed it. And then, as you indicated, I had a liver biopsy. I had tumors in my liver too, and that's where they did the genetic testing from that. Now, regarding the hospitals, that's interesting. So I have a daughter who is the COO of a multinational corporation, and she's extremely aggressive and organized. She lives in London. She got on a plane and flew here and said, "I'm taking charge of finding your medical team." So she called all around and sent my medical records sent everywhere, City of Hope, Cedars-Sinai, UCSF and others. And I went and saw specialists at Cedars and at UCLA. And Dr. Chapman had suggested Dr. Park here at St. Jude, who is not a pancreatic cancer specialist, but is a very good oncologist. And what the other places told me was, there are no special treatment, there are clinical trials, but the standard for you are these 2 types of chemotherapy. That's what we give you. And Dr. Park says, "Yeah, that's what I'll give you." So I said, well, let's see, I can drive into LA or I can drive 5 minutes to St. Jude. So, so for 2 years, I've been just going to St. Jude, you know, and it's been fine. I've kept the 2 pancreatic cancer specialists, one at Cedars and one at UCLA, sort of in the loop. But you know, as long as I was on the standard treatment, there was nothing really to be done. So now, and then I had the pills I explained, and now that I'm looking for something, I may or may not stay local depending on what I can find. So people were very surprised. You're going to St. Jude? Well, yeah, because nobody else can do anything different for me, and it's very convenient.
Question on why so few are taken out, surgery. Is it because they metastasized before?
Yes.
They know that it's there?
That's right. Yeah. I mean, once they see, if you have a local, I mean, I'm not a physician, but if you have a localized tumor and it hasn't grafted onto too much to the surrounding tissues or other organs, then you can remove it. I guess it knows what it involves. But in, as we said, 80% of the cases, by the time that it's diagnosed, because of the problems we talked about, it's already too late. It's spread too far, and you're not a candidate for surgery. Sure, I can stay a little bit longer. Yeah.
Thank you, Art. He's going to stay afterwards, so anybody's got any questions for him, feel free. He's good with that. I want to thank Art for coming. Usually we have a speaker's gift.